Well, the VA is on the hot seat again, the Veterans Administration. The VA hospital in Arizona is under investigation for a whistleblower who says that for some time, purposely just to get good grades so the administrators could get bonuses and so forth, treatment was delayed for quite a few people, resulting in the death of some 42, 43 people. And this is not unusual in the VA system. There was a report that came out in 1999 that said there's hundreds of thousands of minor errors each year in the VA system in America, 3,000 of which cause the patients to have serious injuries to the point where they had to remain in the VA system forever. You know, they couldn't get out. They had to stay for the rest of their life in the hospital. And it also said of those 3,000 serious injuries each year in the American VA system, there were 700 killed. That's the word they used. And the investigation was done by the Veterans Administration. And they said there were 700 veterans who were killed, directly killed by VA doctors each year in America. Now, last year in Afghanistan, the enemy killed 375 U.S. soldiers. The enemy kills 375 each year, and American doctors kill 700 each year, almost double. So somebody needs to go to jail here. And what I urge everybody to do is get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to take care of yourself, particularly if you have veterans in the family. We need to take care of these ladies and gentlemen who have given their time and efforts, and in some cases limbs and their eyes and bodies and in death, gave their lives for this country. They deserve a better deal than this, okay? We need to take care of them, and since the VA system is failing them, since our country is failing them, we have to take over and get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases. We can get these guys and gals off of dialysis. We can make them ex-diabetics. We can, in fact, reduce the risk of Alzheimer's disease by 80%. That's right, we can reduce the risk of Alzheimer's disease by 80%. This is very simple stuff. Do not our veterans deserve the best instead of the same old, same old? Insanity, Albert Einstein said, is doing the same thing over and over and expecting a different result. Well, I don't think the VA hospital is going to give us any better result because it's run by standard medical doctors whose, you throw in the bureaucracy piece, they're more interested in keeping their job than they are taking care of these veterans. That's very obvious. They're interested in bonuses more than they are taking care of these veterans. And I personally am really very sick and tired of this. And so what I'm going to do personally, I will personally pay for any veteran who wants to become a Longevity Associate and do this as a business to help our other veterans. I will personally pay for their associate $10 fee to get in and do the Longevity business. Because in fact, that's one of our projects in Longevity is the Wounded Warrior Project, and we spend a lot of time, money, and effort making sure that our veterans coming home from war zones, injured, that they get more care. We want them to get more care. So we're putting our money where our mouth is, donating to the Wounded Warrior Foundations, and I will personally pay for the $10 business fee for any veteran who wants to do a Longevity business. We need a bunch of them to help out here. Now, these veterans coming back with emotional problems, mental problems, committing suicide, very high rate of suicide, shooting up places, a lot of domestic violence, just because they're malnourished. You can't live on meals ready to eat for 3 years and soft drinks and no vitamins, minerals. They're coming back. They're just totally a mess nutritionally, which includes their brains. And we can eliminate all that. All we want to do is make sure that every veteran gets the 90 essential nutrients appropriate for their body weight and eats right. And this is such a simple thing. Why do not the cream of the crop? Why do not the best of the best get the best? Well, that's because it's all sort of, what should I say, budgetary bureaucrats. They know nothing about health and nutrition, and the medical doctors they ask know nothing about health and nutrition. And so it's time that we, the people, take over here and support our veterans, support our military when they're in the war zones, and support them when they come back. They need nutrition. I want every family member to be sure to send our veterans out there doing their work, our active duty military, regardless of the branch of service. They need to have the 90 essential nutrients. They'll come back home physically healthy and mentally healthy. We don't give them these 9 essential nutrients. They come back physically devastated and mentally devastated. The rate is too high. The suicide rate amongst our veterans is considerably more than the suicide rate here in the United States. And that's because they're malnourished, not from calories certainly, but they're malnourished from the standpoint of nutrients required by the brain to be sociable, to function properly for problem solving, memory. And this is something we can do very economically and very cheaply. Again, I will personally pay for the veterans who want to come in and work the longevity business. I will pay their $10 fee. And give us a call. Ask your longevity associate to help you out if you're a veteran or you're a family of a veteran. I just can't fathom VA doctors killing 700 veterans a year. That's what the VA system, that's the word they use, killed. They didn't say they died. They said they were killed by medical doctors in the VA system. Let's save our veterans. We'll be back with more truth, justice, and the longevity way. And dead doctors don't lie after these messages. Okay, we got Billy sitting in for Doug today. And Billy, what pearls of wisdom do you have for us?
Well, Doc, I found an interesting story in the news. This is reported from the Associated Press not too long ago. Kids get codeine in the emergency room despite the risks. It seems that the right hand doesn't know what the left hand's doing here. And what I mean is some doctors, pediatric doctors, know that codeine's really not a good thing for most kids. But apparently the word hasn't gotten to the emergency room. Despite recommended limits on codeine use in children, the potential painkiller is prescribed for kids in at least 500,000 emergency room visits each year, according to a recent study. Use of the drug in that setting is hardly rampant. Just 3% of ER visits for kids resulted in a codeine prescription. But the 10-year study did find that more than 25 million ER visits by children each year are seeing that far too many kids are getting the drug when better options are available. Codeine, as you know, is an opiate drug, and the problem comes in with a genetic variation in some kids. It makes some people metabolize it much too quickly, and of course, when you're a small person, a child, when you metabolize this kind of a drug too quickly, it results in problems, difficulty in breathing, excessive sleepiness, and I would imagine if a severe enough reaction, probably even death or something almost as bad. There's several reasons why the Food and Drug Administration issued the strictest warning last year for this life-threatening complication or even death in children given the drug after certain surgeries. Anyway, I thought I'd bring it up because it illustrates, at least to me, that the right hand doesn't know what the left hand's doing a lot of time when it comes to medicine.
You're exactly right, Billy. Thank you. Just to show you what kind of harvest these doctors get out of the deal, this came out, I think it was 2006. When you look at prescription errors, this is classed as a prescription error where they give children codeine. This is a prescription error. This is not recommended stuff, right? This is a prescription error. These types of prescription errors, now hold on to your seat, Billy, results in 1.5 million deaths and permanent injuries each year in America.
Wow.
1.5 million deaths and permanent injuries. These types of prescription errors. We're giving the wrong drug to the wrong people. Okay, wrong dosage, fulfillment problems by the pharmacist, and codeine is in that batch. And so 1.5 million deaths and permanent injuries resulting from prescription drug errors, particularly while people are hospitalized and are undergoing procedures at the hands of doctors. And our kids are really at risk. More kids are given addictive narcotic drugs from prescription drugs by doctors than are given given narcotic addictive drugs by street dealers.
Wow.
And so somebody needs to go to jail here.
Well, that's quite a statistic.
Yes, 1.5 million, and it's just absolutely criminal. There's much better things you can do for kids, as hypnotics, I call them, where they really don't totally anesthetize them, and they just make them sort of almost like they're hypnotized, and they can actually take a non-addictive pill for this. There's all kinds of stuff they can use which are not codeine, and pediatricians inflict some of the worst damage. They do this because they formulate pediatric nutritional formulas, and this came out April of 2012 in food chemistry. Baby formulas contain less than 20% of the minerals and vitamins babies need, formulated by pediatricians. Dogs get 100%, rats get 100%, chickens get 100%. Formulations by medical doctors for our babies get less than 20%. Somebody needs to go to jail here. Thank you, Billy. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Billy, let's go to callers.
All right, Doc, let's head to Kentucky and Kathy. Kathy, you're on with Dr. Wallach.
Oh, Kathy, you're on the air.
Hello, Dr. Wallach.
Hi, how can I help you?
I am fine. I have a friend named Marissa who has been battling breast cancer for 4 years. She went the usual treatment of chemo and surgery, and in January of this year, she went to a Mexico clinic for holistic treatments. And since then, her latest scan shows that it's moved into her liver and on 3 of her vertebrae. Can we help her?
Yes, certainly. She's in stage 4, it sounds like, which is a very severe, life-threatening position to be in. How much does Marissa weigh?
About 120.
Okay. Does she have any other issues I need to know about, diabetes or heart disease? Or?
No.
Okay.
No, she's in her early 40s, and she doesn't have other problems.
Okay, very good. All right. Well, what I would do is change her diet, because her diet's what got her in trouble. You can reduce the risk of breast cancer by 462% by eating meat cooked medium rare rather than well done. That's a statistic that came out from the University of South Carolina in 1998. So I would make sure that she's not going to eat any burnt meats, any burnt animal fat. She can have roast beef, but it's got to be cooked medium rare. She can have a steak, but it's got to be cooked medium rare. She can have a hamburger, but it's got to be cooked medium rare, okay? Nothing well done. No fried foods whatsoever, no exceptions, absolutely no processed meats with nitrates and nitrites. We're talking about deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, because those nitrates and nitrites are cancer accelerators. Then she needs to stay away from oils. They're also cancer accelerators. They oxidize her into trans fatty acids, heterocyclic amines, and acrylamides. All 3 of those free radical sources are worse chemicals than anything that Monsanto and Dow Chemical make when it comes to causing cancer. And so she can't have those things. No salad dressings, no cooking oils, no olive oil, no coconut oil, none of that stuff. Then no gluten, no wheat, barley, rye, and oats. No wheat, barley, rye, and oats. Then at 120 pounds, I'd have her take 1 healthy brain and heart pack per month, get her an extra bottle of selenium, so she could have, that will allow her to have 3 selenium at breakfast, 3 at dinner. That will allow her to have 1 tablespoon, which is a half ounce, of the OsteoFX Plus at breakfast and dinner, 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, the 3 EFA Pluses at breakfast and the 3 EFAs at dinner, and all that will be accomplished by the 1 extra bottle of selenium and the 1 healthy brain and heart pack per month. I would also have her take the Z-Radical, an ounce twice a day, that's 2 quarts a month, and the Cell Shield RTQ, 3 of those twice a day, and that's going to give her a better quality of life and certainly extend her life longer than whatever, if her doctors say 3 months, she might have 2 or 3 years. If they say 2 years, she might have 3 or 4 years. She may even do better than that. Give us a call every couple of weeks, Kathy. Keep us up to date. We'll be back after these messages. Okay, Billy, let's go to callers.
All right, Doc, let's head to Georgia and talk to Everett. Everett, you're on with Dr. Wallach.
Everett, you're on the air.
Hey, Dr. Wallach, this is Everett Ben. I've talked to you before about my granddaughter, 10-year-old granddaughter with rheumatoid arthritis, and she's taken the Healthy Bone Pack for 3 months, and I switched over from the powder to the liquid calcium, and now she's taking the BTT and the liquid calcium and glucogel. And she went to the doctor recently. My daughter took her to the doctor, and the MD's rheumatoid guy said that her left knee and left ring finger are becoming deformed, growing the wrong way, need to put her on a methotrexate to help her body to stop attacking itself and to help them grow correctly as she's growing. And he also added that he said her inflammation is going down in the right and left ankles. So,
I'm sorry, I missed that. What's going down? What's going down in the right ankle?
Inflammation in her right and left ankles.
Okay, well, first of all, how much does she weigh?
She's right at 100 pounds.
Okay. I'd be a little heavy with her because she's starting to get some deformities. I'd be a little heavy with her. I'd give her 5 of the glucogel capsules twice a day. I'd give her 2 at 100 pounds. I would give her, selenium, 2 of those twice a day. It'll be 1 bottle a month. Make sure she's getting the OsteoFX Plus. I'd give her 2 ounces a day of the Osteo, the liquid preferably. I'd give her 1 ounce of breakfast, 1 ounce of dinner, or 1 ounce of breakfast. You actually give her a tablespoon of breakfast, a tablespoon of dinner, and an ounce at bedtime. That'd be another way to do it. And then, of course, the Beyond Tangerine 2.0, I'd give her 1 scoop at breakfast and 1 scoop at dinner. And I'd get her on a gluten-free diet to maximize absorption. We have very, very good results with this with kids with juvenile rheumatoid arthritis. Did you ever give her any of the minocycline antibiotic?
I'm not sure my daughter got that. I know she was taking some antibiotic there for a while. But,
yeah, she should have gotten, in the early stages, she should have gotten the minocycline. Methotrexate is just an anti-inflammatory. It's not going to stop the progress of a disease. It actually just reduces swelling and that sort of stuff, so you have less discomfort. It certainly can have a lot of negative side effects, including you have to really ramp up on folic acid supplementation. And so that's why I'd go and make sure she's gluten-free and maximize absorption. Does she have any history of asthma or skin problems, any eczema, dermatitis, anything like that?
I don't think so, no.
Okay.
My daughter said it was naproxen that she gave her.
I'm sorry, you got all buzzy there. What did you say at last sentence?
Naproxen was the medication that the doctor gave her before. Mm-hmm. I guess that's like the...
I like minocycline better. It's much more effective directly against the mycoplasma bug that causes rheumatoid arthritis. So you might ask him about that. And it wouldn't hurt to get some of these little finger braces and things that she could put on and kind of retrain that finger. She can do her own physical therapy, extend that finger into the right position as much as she can. Obviously, you don't want her to break her finger, but you want to get to her maximum extension that she can comfortably. Use the CM cream that comes with the Healthy Bone and Joint Pack and get rid of some of the discomfort and swelling. I'd prefer to use the CM cream than I would the methotrexate for a kid. But keep us informed of what's going on here and ask him about minocycline. We'll be back after these messages.
Doc, let's head to Michigan and Jeannie. Jeannie, you're on with Dr. Wallach.
Hello, Jeannie. You're on the air.
Hi, Dr. Wallach. I am 53 years old, and I just come across your product, and I was wondering, I was trying to get my husband on it and my 14-year-old daughter, and I was wondering what I should take before I purchase anything. I do have high blood pressure. They did diagnose me with osteopenia a few years back, and I was in an industrial accident years ago, back in 91, when I had 1,000 pounds fall on me, and it seemed like I never was the same since then.
Mm-hmm. And was this something soft, like a bag of potatoes, or was it steel?
It was steel. Steel.
Okay. And where did it hit you, in the back or the legs, or what?
It hit me in the back, my upper back, and it slid down and just laid on my lower back.
Okay, so back. Are you able to walk without a walker or wheelchair, or what?
Yep. I if you look at me, I look perfectly fine, but I do have problems with my nerves. My left leg will go numb. Everything's on my left side of me. So that is a problem. My shoulders will hurt me. My upper back will just creating pain sometimes. But
and what do you weigh here, Jeannie?
I weigh 149, and I'm 4'10".
Okay, so at 4'10", I would say you're probably 49 pounds overweight.
Yes.
Okay.
Yes, I am.
All right. This is a Shar thing. Shar, are you there?
Yes, I'm here.
Okay, she's about your size.
Mm-hmm.
We have a weight problem. We have a chronic injury to her back. She got some peripheral neuropathies on the left side, high blood pressure. What would you do for this young lady?
Well, I would put her on a gluten-free diet, but I also would give her 2 healthy bone and joint packs.
Okay.
For now. I mean, she can cut it down as she loses weight.
Mm-hmm. And what would you do for the weight?
ASAP.
Okay, and what would you do for the high blood pressure?
Ultimate Daily.
You get an A+, kid. Okay, so Char's exactly right, Gene. I'd have you take 2 of the Healthy Bone and Joint Packs per month. That will allow you to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 Nutri-Crystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. There's the CM cream that comes with that that will allow you to apply that topically and relieve pain for 3 to 5 hours. And after several weeks or months, you should have to use that rarely. For the high blood pressure, and have you take 3 of the Ultimate Daily Tablets at breakfast and 3 at dinner. That'll be 1 bottle a month. And let's see here. For the weight loss, I'd have you add the ASAP, as Shar said. I'd have you take a dropper full under your tongue 30 minutes before each meal. And you want to hold it there and let it be absorbed through the oral tissues. Do not swallow it. And so otherwise you'll digest the nutrients. And you'll be amazed. After a day or 2, you'll be able to start losing a half a pound to 2 pounds a day. And so you can really look forward to anywhere from 2 to 3 months. You should be able to be down to 100 pounds or less. And again, the peripheral neuropathies you have on the left side can be due to bone spurs, disc injuries, all that kind of stuff. But with a 15 glucogel a day, that's going to certainly support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Okay. Give us a call every couple of weeks and give us a progress report, and we'll walk you through this. Okay, Billy, let's go to callers.
All right, Doc, let's head to Virginia and Carmen. Carmen, you're on with Dr. Wallach.
Hello, Carmen, you're on the air.
Hi.
Hi.
I was calling because of my mom. She's 86, and a month ago she was tested and did not have Alzheimer's and dementia, and my sister decided she wanted power of attorney over her, and now she's got it, and she won't let me have any access to the HIPAA, so I don't know whether she really has it or she just wants her money. So I wanted to get her on. She's taking 15 glucogel for her knees, for the cartilage in her knees, and the BTT 1 a day, but she probably needs 2 a day because she weighs 180, and she should weigh 100 because she's only 5 feet 4'11" or something like that. And I didn't know what she needs for the Alzheimer's or dementia if she does have it to make it reverse.
Okay, well, there's several different types of dementia. And Shar, are you there?
Sure.
Yeah, what would you do for, what were some of the things you'd do for somebody who's 86 years old for dementia? We've already talked about the Healthy Bone and Joint Pack here because she obviously got knee problems. Right. 180 pounds. What would you do for dementia?
Well, first of all, on the de-stress, but also she needs to eat a lot of eggs and butter.
Okay. What would you do in case it was vascular dementia?
In case it's vascular dementia, Ultimate Daily.
Well, perfect. Very good. Okay, well, that's where I would go, Carmen. Again, 2 Healthy Bone and Joint Packs. You're quite correct there. And as Shar said, for dementia, there's several different types of dementia. I would throw in the de-stress capsules, 3 of those twice a day. That's 2 bottles a month. The Ultimate Daily tablets for the vascular dementia. It supports and promotes healthy blood flow through obstructed arteries in the brain, the eye, the heart, the kidneys. And so that'd be 3 Ultimate Daily tablets twice a day, 1 bottle a month. And wouldn't hurt also, I'd throw in the Smart FX, 3 of those twice a day, 2 bottles a month. That has the DHAs and EPAs, which are the raw materials for the neurons to make neurotransmitters for memory and for cognition, problem-solving stuff. It doesn't hurt for you to always get another opinion from another neurologist or who would be able to diagnose her. Just remember, they're hungry, and they will say she has dementia just because she will become their patient. And so you really have to get several opinions here. Don't be bashful about that. People get several bids when they're putting a roof on the house. And so that's kind of the direction I would go. Okay, give us a call every couple of weeks. Let me know how things turn out. If you have a lawyer involved, he's welcome to call the show. We'll be happy to talk with him. Okay, Billy, let's go to callers.
All right, let's move to Illinois and Sharon. Sharon, you're on with Dr. Wallach.
Sharon, you're on the air.
Hi, Dr. Wallach. I saw you on Benny Hinn's show. And
Thank
I
you.
have a very dear friend that almost died in the hospital because she has COPD, and she developed pneumonia, and then she got a MRSA infection. So she's number 1. I don't know.
How much does she weigh?
She probably is maybe, I would say, 170 pounds or something like that.
Okay. And how old is she?
She's over 65. I know she's about 70, something like that.
Okay. And COPD, chronic obstructive pulmonary disease, chronic respiratory disease. Does she have any other issues, diabetes, arthritis?
No, not really. But she went in with pneumonia.
Mm-hmm.
And then
she out of the hospital now?
She's out of the hospital, but extremely no energy. Could hardly walk across the room.
Okay. Does she have any history of skin problems, eczema, dermatitis, psoriasis, rosacea?
No, but she does have diverticulitis.
Okay, well, that's enough answer. Okay, Shar, diverticulitis, what's she got?
She's got a gluten intolerance.
Absolutely. So, no gluten, no wheat, barley, rye, and oats. And what would you do for a 65-year-old gal, weighs 170 pounds, that she needs some increase in circulatory power through her lungs?
Well, I would give her the Ultimate Daily and Cardio FX, but she should have two. I would give her 2 healthy heart and brain packs.
You got it, girl. Okay, give us a call every 2 weeks, Sharon. Let us know what's going on. But she's got to be gluten-free, drop-dead gluten-free. That's her basic underlying problem. And then she'll be able to absorb all these nutrients. You are not what you eat. You are what you absorb. And we'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Billy, let's go to callers.
All right, Doc, let's head to Texas and Diane. Diane, you're on with Dr. Wallach.
Hi, Diane. You're on the air.
Hi, Dr. Wallach. I'm calling today about my husband. I want to get him on the products before I start because I think he needs it more.
Okay.
I'll tell you he's 5'10", age 73, weighs about 225. He had his gallbladder removed in 2012 and his appendix in 2009. His tummy is like a basketball.
Okay, does he have any skin? Wait a minute. Does he have any skin problems?
You know, if that would be beneficial.
Okay, we only have a few moments here, Diane. Does he have any skin problems?
No, he has GERD, high blood pressure, high cholesterol and triglycerides, enlarged prostate, arthritis, chronic sinus, and tremors in his right arm.
I'm sorry, what in the right arm?
Tremors.
Tremors, okay. Okay, Shar, this is a Shar thing. He's got 6 diseases here. He's had his appendix out, gallbladder out. What's he got?
He's a typical gluten intolerance, mega gluten intolerance.
Yep. Yeah, the whole household, as Shar says here, Diane's got to be gluten-free, including the dog and the cat and the mother-in-law, any kids that are in the house, anybody, yourself. Everybody's got to be drop-dead gluten-free because of cross-contamination, the laundry, the bed, the couch where everybody watches TV, the food preparation service. There cannot be any gluten in the house. He cannot go anywhere where there, you can't go to any of these places that are famous for spaghetti and pancakes and waffles and stuff like that. Cannot do it because he is, as Shar says, drop-dead gluten intolerant. They're cutting apart piece by piece, getting all these diseases. And because he has high blood pressure, he's got, let's see here, arthritis, I'd go ahead and give him 2 of the healthy bone and joint packs per month, full dose for everything at breakfast and dinner, 15 glucogel a day. What would you give for gallbladder being removed, Shar?
Enzymes, ultimate enzymes.
Ultimate enzymes, we call it the gallbladder bottle. You're exactly right. I'd have him take 2 of those a minute or 2 before each meal with a couple ounces of water. I would also, for the high blood pressure, Shar, what would you give him for the high blood pressure?
Ultimate Daily.
Ultimate Daily, 3 twice a day. That's 1 bottle a month. And for the prostate, Shar?
Prost FX.
Prost FX, there you go. I would give him the Prost FX, 3 of those twice a day, 2 bottles a month. Because he's on the bone and joint pack, I would go ahead and give him also some selenium. I'd give him 3 selenium twice a day. That's 2 bottles a month. Selenium is to the prostate gland as iodine is to the thyroid gland. And this can be a major change in his life if he wants to survive. He's in a life-threatening situation here. He's got several life-threatening diseases here. They've already taken 2 valuable pieces of organs out of his body, his gallbladder and his appendix. He's bloated. That's because he has a gluten intolerance. And dogs and cats, if you have them in the house, fish and birds, they got to have gluten-free food. They cannot have gluten dust floating around and dogs putting their head on his lap and all this kind of stuff. Give us a call every couple of weeks. We can save your husband, but he's going to have to submit to changes in diet and a heavy supplement program here. Okay, we've only got a moment left here. Shar, any parting words today for our listeners?
Take care of yourself as good as you take care of your car, and everything will be fine. Everybody needs to be on at least a Healthy Start Pack for just the bare minimum, and you build on that from that, you know?
Very, very good. So it's one Healthy Start Pack per how much weight?
For 100 pounds of body weight.
Very good. Perfect. And it doesn't matter age. Let's say it's a 10-year-old kid. If they weigh 80 to 110 pounds, that's one Healthy Start Pack. If they're 75 years old and they weigh 300 pounds, that's 3 Healthy Start Packs. Just like Shar said, it's one for 100 pounds of body weight. It has nothing to do with age, gender, race, culture. It all has to do with poundage. That's why it's so accurate. And thank you so much, Shar, A++ today, as usual. Thank you so much, Billy, who did double work today. He was the producer and the call screener, so really appreciate you, Billy. Super job. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.